For patients who have failed medical management or who have not had success with the injections or can't do the injections for one reason or the other, penile implant surgery is usually the answer. I usually expect my patients to stay in the hospital overnight and then go home the next day. Like any other surgical procedure, we require that you get your clearance from your primary care physician for a general anesthetic and surgical procedure. Before the surgery, you will be receiving information in regards to what medications that you need to stop and what medication you can continue to take safely until the day of your surgery. Yes, there are some eating and drinking restrictions. Usually we need at least 8 to 12 hours without eating or drinking prior to surgical intervention. But again, everybody's different and you will be getting specific information in regards to that prior to your surgical procedure. Well, we want you to bring some comfortable clothes. During the hospital stay, you'll be wearing the hospital gowns. But after that, we want you to have some comfortable clothes that you'll be able to go home with. We don't like things that are too tight, and we also don't like things that are too loose. I prefer some compression shorts for the patients. I think that helps the most. No, we don't want you to shave before the surgery. That actually increases your risk of getting an infection. So we're going to take care of that in the operating room. On the day of the surgery, you'll be asked to arrive at a specific time, which is usually about 2 to 3 hours before your surgical procedure. And you'll be given instructions about where to go and what to do. The pre-op nurses will take care of you during that period of time. You will be able to also talk to your anesthesiologist and also visit with me before the surgical procedure starts. Being anxious or nervous before your surgical procedure is completely normal. And all I advise you to do is just relax. And when you get to the hospital, you're going to talk to the hospital staff and to our anesthesiologist, and we would be able to give you something if you need it for that. So please feel free to call me or my office with any questions or concerns that you have before the surgery. We are available to take your messages 24/7, and we usually are able to answer them within about 24 to 48 hours.